Hello everyone, my name is Eric Sanchez, and with my group members, Anna Curry and Laura Sitawan, we want to talk about the United States for our One Nation project. It's a country that many of us hear about all the time, through movies, news, or even personal experience. But beneath the image of success and opportunity, there are some deep challenges that often go unseen. In this video, we want to talk about the two of the most urgent issues facing the US today: the crisis of drug addiction and the failing healthcare system. These aren't just political issues or headlines, they're affecting real people every single day. The United States is known around the world for innovation, freedom, and diversity. It's home to some of the most groundbreaking technology, movements for justice, and ideas that have shaped the modern world. It's a country that has overcome civil wars, depressions, and cultural divides. And across the country, there are people from every background working hard to build stronger and more compassionate communities. But there are wounds we must confront and bring awareness to. First of all, the drug crisis has grown far beyond what most people realize. It's not just happening in certain areas or communities, it's everywhere. In cities, suburbs, and rural towns, families are losing loved ones to addiction every day. On average, more than 150 people die from opioid overdoses every single day in the United States. That's like a small plane crashing every day. And these aren't just statistics. These are sons, daughters, parents, friends, and many of them young. In 2015, about 12,000 people died from stimulant-related overdoses. By 2022, the number had skyrocketed to over 57,000. And nearly 70% of those deaths also involved fentanyl, a synthetic opioid that's 50 times stronger than heroin. Fentanyl is often mixed into other drugs without users even knowing, making it incredibly dangerous. Many people didn't set out to become addicted. It often begins with a simple prescription for pain. But over time, that painkiller can lead to dependency, and what once helped becomes something that harms. Experts describe the opioid crisis in three major waves. The first wave began in the 1990s, with overprescription of opioids for pain relief. The second wave hit in the 2010s with a rise in heroin-related deaths. And the third wave, starting in 2013, is the most deadly, driven by illegally manufactured fentanyl in synthetic opioids. In 2022, nearly 43% of overdose deaths involved both opioids and stimulants, a deadly combination that's extremely hard to treat. This is more than a public health issue. It's a personal and emotional one, and it's deeply tied to the next challenge we want to talk about, which is healthcare. For a country with some of the best hospitals, doctors, and technology in the world, the US has a shockingly broken healthcare system. Millions of Americans can't afford the care they need. Some skip routine checkups, others avoid emergency rooms, even in serious situations, because the cost of the bill feels more frightening than the illness itself. Over 26 million Americans are currently uninsured. That means they have no healthcare coverage at all. And another huge portion of the population is underinsured, which means they technically have insurance, but their out-of-pocket costs are so high that they still can't afford treatment. In fact, about 1 in 4 working-age adults are underinsured. Many delay or skip doctor visits, avoid getting medical tests, or can't afford their prescriptions. That means preventable conditions go untreated, and small issues can become life-threatening. A recent report describes how the US system is heavily fragmented. Nearly half of Americans rely on employer-based insurance, which disappears if they lose their job. While the Affordable Care Act, ACA, helped expand access to insurance, it didn't fix the core problem. Healthcare is still widely expensive. The people who suffer most are often already vulnerable: low-income families, minorities, immigrants, older adults, and rural communities. And here's what's even more disturbing. According to Gapminder, we can see how the USA is spending far more than other countries on healthcare. But despite that, it ranks the lowest in healthcare outcomes among 10 high-income nations, And you would think that with all the money being spent, Americans would be living longer, healthier lives. But that's not the case. In fact, also seen through Getminder statistics, the US has the lowest life expectancy for both men and women among wealthy countries. And these issues affect everything else. When people are sick but can't afford care, they miss work, fall deeply into poverty, or become dependent on emergency services that are overwhelmed and underinsured. It creates a cycle that's incredibly hard to break. This isn't just a healthcare issue, it's a human dignity issue. No one should have to choose between buying groceries and getting life-saving treatment. A healthcare system should exist to heal, not to profit. It should protect the most vulnerable, not punish them. And it should be built on compassion, not just cost. So what can we do? We're just students, right? We're not doctors or lawmakers. We can't solve these huge problems overnight. That doesn't mean we're powerless. At Hands-On Global University, we're being equipped not just with knowledge, but the vision and purpose. Whether we're studying law, psychology, engineering, or global development, we can ask deeper questions. How can I use what I'm learning to serve others? How can I be part of the solution? For Hannah and me, as Americans, these issues hit close to home. We've seen people we love wrestle with healthcare bills, addiction, and broken systems. We've even personally experienced these issues, but no matter where we come from, we all have a role to play. Maybe some of us will help design more compassionate policies. Maybe others will build better medical systems, counsel those struggling with addiction, or fight for justice through law. What matters is that we don't turn away. The US is a beautiful nation with real pain, but also real potential. As students, we're not just preparing for careers. We're preparing to be leaders, servants, and healers. And our calling isn't just about personal success, it's about global transformation. Let's be people who move towards suffering with courage and lead with wisdom, empathy, and hope. Thank you.